Rare genetic condition is giving a Michigan toddler Hulk-like strength. 3-year-old Liam Hoekstra has the quickness of a cat. He can lift pieces of furniture that most adults have problems with, and he eats like a horse without ever gaining weight. But aside from being a cool story, the boy's condition could help scientists unlock the secrets of muscle growth and muscle deterioration. And here with us now is physician and surgeon Dr. Katrina Firlik, formerly of Yale University's School of Medicine. Doctor, thanks for being here.
Thanks for inviting me.
Okay, just to tell the audience what Liam does, at 2 days old, he could stand up. That's obviously unheard of for a newborn. At 5 months old, he could do the famous gymnastic move called the iron cross, where he holds himself out like this on rings. Most adult men cannot do that.
Exactly.
How is this possible?
Well, it's a very rare genetic condition, and it's a very interesting condition because what happens is there's a defect in his personal genetic code that allows for excessive muscle growth. I think it's interesting to explain just a little bit deeper in that it's almost like a double negative in his body. There's a defect that causes a blockage of a normal function in our body that usually blocks muscle growth. So by blocking the blocker, you allow for extra growth.
It's called myostatin-related muscle hypertrophy, and there's only 100 known cases of it in the world. Is there any medical downside to what this little boy has?
Well, originally, because the heart is a muscle also, there was the thought that could this cause enlargement of the heart, which could lead to heart failure. And there aren't that many cases out there, so it's kind of unclear, but the thought is now that it probably isn't an issue. So this is really kind of a lot of upside without much downside.
The only financial downside for the family, we're told, is that this little boy eats constantly. He has 6 full meals a day. Why?
Well, because his metabolism is so revved up. I mean, he has muscle mass that needs to be fed, and so he just eats constantly to feed the metabolism.
So at 5 months old, he can do this iron cross maneuver. We're told that he can lift his family's sofa. How far out does this go? Does he become the Incredible Hulk, for lack of a better imagery? Does he just have massive muscles all over his body?
Well, it's interesting because if you actually look at a child like this, he doesn't necessarily look totally different. It's just that his muscles are stronger. If you look at animals, though, with this disorder, they do look incredibly stronger because it's a little bit of a different disorder.
His parents have described him as having a six-pack, that he has actually defined abs. So this condition that he has, what are the medical implications for the rest of us?
Very interesting. What you can think of is if you can design a drug that could mimic this condition, you could treat numerous people who are suffering from muscle wasting disorders. So the obvious example would be muscular dystrophy. It affects about 100,000 people in the U.S., but muscle wasting is a very important part of, say, cancer, of AIDS, even normal aging, and that affects our well-being as we age. So if you could design a drug that was safe, it could have incredible implications.
Right, so medically it could be very useful for people with, say, degenerative diseases like ALS, Lou Gehrig's disease, but would it also be open and ripe for abuse of, say, athletes, professional football players who would want to use this?
Definitely, and that would be the worry. Obviously, we have to think of the patients first, and it's going to, probably, hopefully will be developed. There's always the potential for abuse. It could be the next steroid, for example, but steroids only have the potential of increasing muscle mass by about 15 to 20%. This could do a lot more.
Incredible stuff. Well, we will watch, we'll monitor Liam to see what he goes on to do and what it means for the rest of us. Dr. Katrina Firlik, thanks for coming in.
Thanks, Allison.